Hello, everyone, and welcome to Next-Gen Tips and Tricks on how to document tobacco and vaping cessation for providers. What is tobacco and vaping cessation? Tobacco and vaping cessation is when counseling is provided to patients. Counseling takes about 3 minutes or less. However, it can be more than 3 minutes. We have to screen for smoking use once a year to meet certain preventative care and screening guidelines according to UDS program. Preventative care and screenings, tobacco use screening and cessation intervention has been revised to align with the CMS 138 V9. And here's just a description of the measure along with the initial population that this measure is targeting. Where to locate the vaping cessation. So with an intake to your right hand upper corner, you want to make sure you select the configuration cogwheel. This would then open up the risk factor configuration window. And it's similar in SOAP. The location of the configuration icon is located in the middle of the SOAP note. And then once you select it, the window will also appear. To locate the tobacco cessation screener questionnaires, you want to make sure you just go ahead and select the tobacco usage. And then depending on your social history tobacco panel, you either have to toggle through the panels to locate the vaping use section, or you can just scroll down until you find the vaping use section of the documentation area. You want to then select screening for vaping, yes, and then you want to select the status. You want to select current user. From there, you then want to select yes for the vaping cessation discussed, and then document any information that is pertaining to this discussion. Once you're done, you want to click OK. It's similar for the tobacco cessation. The configuration wheel is located again in intake and in SOAP. Once the risk factor configuration window opens up, you want to select the tobacco cessation discuss hyperlink to your left-hand side. From here, the tobacco cessation discuss window will then open for you, and from here you can select single select close or multiple selection. You can also choose smoking effects education. Once you select this, I do want to point out that the window will automatically close for you, but it does save the progress. But if it doesn't close for you, you always want to make sure you go ahead and select save and close. To access the tobacco cessation documentation template, you can access this through the navigation bar in intake to your left-hand side, or the navigation bar in SOAP, which is located to the lower portion of SOAP to your right-hand side. And it's in SOAP, it's indicated by a half circle tab with the color purple. You go ahead and select the tab. The navigation bar expands for you in SOAP, and you select the tobacco cessation hyperlink. From here, the tobacco cessation template opens up from you. And from here, you can document medication screening questions, plan, recommended treatment, instructions, etc. Or you can also document a treatment outcome or any follow-up outcome. So documentation continue. If you create a plan, you do want to make sure you add an assessment. You can select the add button, and then the assessment window that you're normally used to seeing will appear. From there, you can add your assessment. And then once you're done, you want to make sure you highlight the assessment and then place order. If you do not highlight the assessment and then place order, you'll receive a pop-up letting you know that you need to highlight the assessment. You can also document recommended treatment. And the final thing to do is submit to Superbill. So once you document your instructions or any information that you find it appropriate, you want to then submit to Superbill. I do also want to point out that when you submit to Superbill, before you submit to Superbill, you do need to scroll up and then highlight the diagnosis you selected so that the Superbill gets pushed through. Once you're done, you add tobacco cessation. Here's an example of the document that will be generated once you select the tobacco cessation button. The final step in this process will be in Finalize. So before you submit your E&M code, you want to document type of counseling, the delivery method, and the type of counseling that was provided. For example, whether it was a verbalized education, whether you provided a handout, etc. You also would document the time spent on this counseling as well. Once you're done, you want to do save and close. After that, you go ahead and submit your E&M code, whether it's by medical decision making, time, or by manually entering the E&M code and submitting to Superbill. Once you do this, all the information will transfer over to your master document and it will be shown as is. In regards to patient education, please continue to use patient education as you normally would. You can access the patient education hyperlink via the tools bar under file and patient education, or under your SOAP note to the right hand side, purple tab, patient education. Any questions, feel free to reach out to the EMR trainers at our email or our phone extensions at Rose, Sims, and Levine. And thank you. This concludes our next tips and tricks on how to document tobacco and vaping cessation. Thanks for joining. See you next time.